Welcome to Freedom to Learn, the podcast that champions choice in education, defends parental rights, and exposes the harm caused by school unions. I'm Jenny Gentles, Director of Education Freedom and Parental Rights at DFI, the Defense of Freedom Institute in Washington, D.C. I met David Zweig, author of the new book, An Abundance of Caution, American Schools, the Virus, and a Story of Bad Decisions, when we both testified before the U.S. House Oversight COVID Select Subcommittee. David's a New York-based author and musician whose work has appeared in the New York Times, the Wall Street Journal, the New Yorker, the Atlantic, the Free Press, and much more. He's also a really fun and interesting person, and I hope listeners will invite him to come speak about his extraordinarily important book. An Abundance of Caution is described as a devastating account of the decision-making process behind one of the worst American policy failures in a century, the extended closures of public schools during the pandemic. Dave and I discuss how media shirked its core duty in investigating the facts and interrogating claims, how health professionals misled, lied to, and manipulated the public, and of course, the pernicious role of the teachers' unions. His book concludes, there was a certain willful dishonesty and fantasy to the idea that making children sit alone, staring at screens, isolated in their homes for hours each day for weeks, and then month after month after month, was going to be anything other than a tragedy for many children. Revisiting that era is unpleasant and infuriating, but necessary in order to ensure that nothing like this ever happens again. David Zweig, welcome to Freedom to Learn.
Thanks for having me.
You start this book that we're going to talk about today, and the book is called An Abundance of Caution, American Schools, the Virus, and a Story of Bad Decisions. You start the book by making it clear that this is not a book about COVID. It's about a country ill-equipped to act sensibly under duress.
COVID is the backdrop. The pandemic is the backdrop for which I use to express larger ideas about how our society functions and how individuals, groups, and those in power make decisions, particularly how they make decisions in times of crisis or when there's limited information. The book very much is about what does the science show about SARS-CoV-2, the virus that causes COVID. What did the science show at the time? The book is not a retrospective. It is not sort of now as we look back on that time. I purposefully made almost the entire evidence base in the book. I purposely did this almost entirely in real time. So there's a chronology as you go through the book, and it's like, here's what was known at that time, and here's what was ignored, and here's why it was ignored or dismissed. So ultimately, that's like the purpose of the book is for people to come away from this after they read it informed and knowledgeable about how the gears turn, basically behind the scenes, like what keeps the machine going, if you will.
And the gears that you focus on, at least in the early portions of the book, would be media and health professionals.
Very much so. Yeah. I mean, and that's the sort of central threads throughout the book is the failure of basically what we would call the expert class. And in this instance would be health professionals and the legacy media. They're sort of our most prestigious media outlets, and how in tandem they failed the public. The health professionals did so by not following what's known as evidence-based medicine or evidence-based practice. Instead, they focused on intuition and they followed sort of theory rather than empirical evidence, which goes against all the basic rules of science. And then this dovetail to that is the media, which didn't challenge the quote experts on the claims that they were making. And instead, in most instances, the media just simply acted as a megaphone. It was simply reporting, so-and-so says you need barriers in the classroom. This is one of the things you need to do to open the school. Or sometimes they would just say, experts say, without attributing it to anyone in particular. But yet there was no investigation into, well, is it true what this expert has been saying?
Right. You said media shirked its core duty of investigating the facts and interrogating claims. You are the media, like you're of the media. So, was this something that you were recognizing as it was unfolding in those early months before other people started speaking up?
The main reason why I even got involved in this was I was observing what was happening, and it didn't seem to make sense to me. I went along with the protocols initially in mid March. I wasn't knowledgeable about what was going on, and I simply trusted the experts, or at least trusted them enough that I wasn't, prepared to ignore what they were saying. But within a short period of time, I felt like there was just a lack of information that was actually grounded in evidence. I saw a lot of opinions. I saw a lot of claims being made, but I wasn't seeing what's the evidentiary basis behind these things. So I just started digging around myself just as a person, as someone. I'm familiar with reading scientific journals. I speak to academics a lot. So I had a familiarity with how to research this material. I just needed to do this for my own sanity. I needed to know what's actually going on here. And unfortunately, what became clear was that very, very, very few people in the media were covering this in what I would consider a sort of appropriate fashion. So ultimately, it just opened up a lane for me where I felt compelled to do it. I was like, no one's writing about this. I'm a writer. I guess I have to do it because no one else is saying this. So I better do it because I'm aware of what the evidence is actually showing. I guess I need to do this now. And that happened over and over as I wrote a long series of articles in a variety of publications over several years during the pandemic, repeatedly. I kept thinking I was going to get scooped by someone else because I'm like, this information is so obvious. Surely someone else is writing this, or multiple other people are going to write the same thing. But time and again, they didn't. Time and again, it was just me. And ultimately, that launched me toward writing this book, where the book is not like a rehashing of my articles. I touch on some of them in the book, but rather the book is an analysis of how this actually happened. It's sort of like pulling the lens back a little bit to get an understanding of how did we get into this circumstance? Why were there so few journalists actually covering this? Why were there so few health officials and others actually following evidence? And my book explains how that actually happened. And in many regards, this is kind of human nature and the nature of societies. And we see this, and I give examples of this throughout history, where we see this type of behavior happening over and over, where there are claims being made, there's groupthink and tribalism and all of these things that motivate individuals, a very kind of in-group, out-group type of way of functioning and seeing the world. And much of that drove a lot of what happened in America.
I hate to bring him up so early in the conversation, but how much of this was related to the media, especially New York Times and the media elites' perspective on President Trump and what he might be saying about COVID, about schools reopening?
Yeah, I would say most of it, like more than most. I mean, nearly all, perhaps. And I give tons of examples of this, but I mean, it's no surprise to anyone that, our country is incredibly divided politically, acrimoniously so. And when Trump tweeted and then began to talk about opening the schools, very vigorously in the way that Trump does, he basically ensured that they would remain closed in half the
Oh,
country.
I knew it. Like, I live in Northern Virginia. Arlington Public Schools was going to open 2 days a week. They told
Mm-hmm.
us that, and as
Yep.
soon as he started tweeting and vigorously coming out in favor of schools opening, I'm like, "They're not gonna open," and I was
Exactly.
right.
See, you were prescient, Ginny. You
Yes,
knew. I
I
mean,
knew. I pulled my kids out of the public school district. I knew they
mhm.
weren't going to open just because they wanted to stay with the cool kids, with the groupthink, with the elite, and
That-
with the anti-Trump,
that's right. Once, and Trump was just by the left and much of the sort of establishment institutions in our culture. Trump was and still is considered such a despicable figure to them that anything anything that he was in favor of just instantly becomes radioactive. It's really, really challenging for these people to think sort of objectively and just be critical thinkers. And you can hate Trump. You can think that most of what he says is foolish and dangerous and all of these things, but that doesn't mean everything he says is wrong. And he happened to be right when it came to schools. But because people had this kind of heuristic in their mind where it's like anything that man says is stupid and horrible, and I therefore must be wrong and I must disagree with it. And that dynamic drove much of the response of these people, both consciously and unconsciously. And I give a lot of examples. This is not, I don't believe this is my opinion. This is just a fact. Like and people even admit this, that they had to behave in this manner, that once Trump said X, I had to say Y. So it's not even like a conspiracy theory, that this is just reality. And I think the psychology of how groups behave is really fascinating. And I try to really explore that in the book. So when someone reads the book, they come away with a deeper understanding. And obviously we all have different intuitions and awareness of how society can behave. But the pandemic was such an extraordinary event, in so many ways. And much of it, I think, is being memory holed and sort of rewritten as this kind of idea, in particular with schools, where it's like, well, it was a fog of war. Things were scary. I was reading an exchange. Someone on Facebook was getting into an argument with someone about my book. Someone texted it to me, and it was like, and the person arguing, well, I don't know where you work, but I was in an ICU. And let me tell you, things were frightening and blah, blah, blah. What that person isn't understanding is that's irrelevant to the thesis of my book, which is about what happens when you don't follow evidence, which is about that these interventions were never going to work over a long period of time, the non-pharmaceutical interventions. And we knew this from the literature before the pandemic. We observed it right in the beginning of the pandemic when Europe reopened its schools and nothing happened. So we knew that schools weren't driving the pandemic. We knew that mask mandates and these other things were not effective because the evidence was actually there with millions of kids, and it was ignored. So
the evidence was there, but it wasn't in the media, Dave. And that's what you cover. The fact that that the European education ministers were meeting May 17th or something, and they're like, you know what? This reopening thing, it's going well. Let's keep it going. May 17th of 2020. We were doing the opposite. We were saying close for the rest of the year. And then for those of us in blue areas, close for an additional year after that too.
It's almost unreal to actually grapple with the facts of what happened, which is that millions of children were back in school in Europe. This is not, a tiny one-room schoolhouse hut in Pakistan or something. We're talking about highly industrialized, sophisticated, countries that in many, many regards are similar to America.
But without the complicated HVAC systems and
HEPA
exactly.
filters.
You know
it, Ginny. Yes. Yep. So, and millions of kids were in school there. The EU ministers met in May. They met a second time in June. This is in the beginning of the pandemic. And they said, we've observed no negative consequences of opening schools. And you didn't even need to hear them say it. Anyone could just pull up the data online because it was available all over the place with these COVID dashboards. And you could observe after schools opened in Europe, cases went down dramatically so. Now, that doesn't mean that schools cause cases to go down, but what it does show is that opening schools was not this just launch point to catastrophe. They were not super spreaders. If they were, there's no way that cases would have gone down when you started sending millions of kids back to school. And on top of it, as you just noted, we also had a lot of claims. Well, that's Europe. That doesn't count. They've controlled the virus. They've done this, that, or the other thing. But they didn't control the virus there. Some countries in Europe had worse prevalence than America. Some had better. And looking at it at the country level doesn't even make sense. America is huge. But when you drill down and look at on a state or city by city or town by town level, there were endless numbers of cities and towns throughout Europe that matched sister cities and towns in America demographically. They had similar population densities and so on. And some of them had higher case rates, some had lower. It didn't matter. They opened their schools, and they did so oftentimes without masking. They did so generally without 6 feet of distancing. Sometimes they did 3 feet or 1 meter, there because they use meters or nothing at all. They did so without HEPA filters by and large. All of these things that we were told were essential in order to open schools, that they're not safe unless we do these things. The schools in Europe were not doing those things by and large, and there was no negative consequence. Nothing was observable that this was causing a problem. It's still hard to wrap one's head around this, that we had this evidence and it was ignored. It's just an astonishing moment. And that's why I spent years writing this book, to try to grapple with such a crazy circumstance that occurred.
Well, we've talked about the media a little. We've talked about health professionals a little. Before we go on to a topic that I think we're going to have a little bit of an argument about,
Okay.
and that's the teachers union and their roles in this. Could you explain what the health professionals in the U.S. were basing their claims on? Because it's infuriating to read in your book. You dug in there, and spelunking, I think, was something that you said at one point.
One of the editors tried to change that word. I'm like, no, it is spelunking. That's when you go into like a cave and you're digging. I'm like, I was spelunking. Come on.
You were spelunking in the supplements to try to find where they were basing these claims. So explain a little bit. When they were saying 2 million people are going to die if we don't shut down for at least, it was 15 days, and then it became 45, and then on and on. So what were these health professionals doing?
I spend a lot of time looking at what evidence sort of ostensibly undergirded the claims and policies of the health officials and health professionals who supported them. And these models that the whole pandemic response was based on, these sort of out of Imperial College of London and IHME and a variety of other places, these models where it showed if everyone follows instructions, then we're going to see this number of cases and deaths. But if you don't listen to us, then we're going to see this. And all of this was based on incredibly, incredibly dubious assumptions. There was not a good evidence base for this. And I recognize that to most people, there's an intuitive sense of thinking, well, sure, if you close schools, there's going to be less transmission. Or if you wear this piece of cloth in front of your face, like, well, maybe it's not perfect, but it's probably going to help a little bit, right? And this kind of mentality. The problem with that is that our intuitions are often wrong. And that's particularly so in medicine. And what we find, and this was obvious in the beginning, and it was in the literature before the pandemic, so they should have known, was that these things might work for a very brief window. If everything is closed at the same time, closing schools might have some effect. There was never any evidence to lead someone to believe that closing schools or doing these hybrid schedules was going to be effective over the long term. Why? Because human beings don't stay home for a long period. They don't comply. Even the introverts among us still are social creatures. And the cellular phone data shows this, that you can see people began moving about before there was necessarily like an official release from some of these restrictions. People have tried, and there's all sorts of stuff in my book about implementation science where they know that people don't comply with guidance or directions that are uncomfortable, that are challenging. People might comply briefly, but their ability to do so or their desire to do so wanes quickly. If you have to take 5 gigantic pills that give you a splitting headache in order to, for fighting some disease, a certain number of people are just going to drop off from doing it because it's incredibly unpleasant. Well, the same thing is true with these NPIs. People like children were not going to just stay home. Neither were adults, including plenty of the people who told me, oh, we're a COVID safe family. Those people were out. I would see them with other families hanging out together. Everyone was, COVID safe as their sort of virtue signal, but they weren't staying isolated. And even if they were, there's nothing virtuous about being isolated either. We still had much of our society out and about serving the upper class and upper middle class who stayed home on their laptops and watching Netflix, while the schlubs, the hoi polloi, they were out there. They had to still work in the slaughterhouse. They had to deliver you your food and your packages. So one of the things that's so important that I don't think's been fully reckoned with is the idea of how classist the pandemic was. This was an incredibly class-based policies that guided what happened. And that's something else that's really a terrible irony, that people on the left ostensibly are the ones, or at least they claim to be, who care the most about the underprivileged in our country, yet their advocacy for these policies, in particular school closures, harmed the very people who they purported to care about the most.
Well, that's certainly what those of us who were arguing for school closures early on were saying. I stopped working in the 2020-21 school year to oversee my children's education and figured it out. It was hard for me professionally and in some ways personally, but plenty of people had to keep working, which meant that their kids were alone trying to navigate these horrible, and you point this out, Google Classrooms with these infuriating links and
Mm-hmm.
barely any actual real instruction. And I think that's something that people who weren't parents during that time might not realize. Remote
Right.
education, remote schooling, it wasn't a child sitting there and being taught by a teacher. It wasn't even that. It was clicking around and trying to understand what your assignments were for the day. So thank you in your book sharing your family's experience with that and just how dispiriting and frustrating that was for your kids. I remember. I remember what that felt like in spring of 2020. So some kids were left alone, and then other kids didn't have parents who hired tutors to try to keep them caught up. And the lack of recognition that, hey, you can hire a tutor. You can stay home. You can hire a retired teacher and do a learning pod. What about the kids at the other end of town? That was just so infuriating for
Uh-huh.
me. So I want to talk a bit about teachers' unions because I feel like they did not acknowledge the class nature of this. They did not acknowledge the disproportionate harm that this was going to have on low-income kids. But in your book, you do say that those on the left these days are saying that, oh, this was a fog of war decision made on best available information at the time. Those of us on the right, and I'm not including you, of course, me, say that this was the malevolent influence of teachers' unions. I actually say pernicious influence of teachers' unions, and I have 5 times during congressional testimony, one of which was at the same time that
Mm-hmm.
you were testifying. You say that neither of these explanations are adequate, so you're not denying that the unions had a role.
Oh,
And
of
in fact,
course.
your
It's a
your
very
book.
important role. Yeah.
Okay, cool. So let's talk about that because I definitely would want to argue if we were downplaying the role. But I was reassured after reading that to find that you talk about Randy Weingarten, head of the American Federation of Teachers, in a New York Times interview in February 2021, saying, "Oh, well, maybe schools will be normal by fall 2021." And then she referred to children as super spreaders. She set the bar so high for schools opening safely that it was, of course, going to be impossible. And then, and Dave, I didn't know this, she tweeted an article about a law firm offering free wills for teachers returning to school.
Oh, you're saying you learned that from my book, right?
That
Yeah,
one
yeah,
I learned
yeah.
from your
Oh,
book. As
wow. Yeah.
closely as I followed this,
You
as
still
much as
missed
I've
that
written about
nugget.
it,
Yeah. You still missed
that
that one.
infuriating tidbit I did
Mm-hmm.
not know. And then the AFT, her union, said it would support any local chapters striking due to reopening schools. So
True.
they did have a huge role in
Oh,
this.
absolutely. Absolutely. So the way I think about it and the way I describe it is that the teachers union simply took advantage of the situation for them. And by the way, I'm sure there are plenty of teachers, rank and file teachers, who didn't agree with this. So I'm not speaking about teachers overall. I'm talking about the unions by and large, who from my
Yes.
observation, are the ones who
Right.
who kind of, spearheaded, how.
Union leaders, particularly in urban environments like the UFD
Correct.
in New York and
That's
some of the
exactly right.
California
Yeah,
cities.
in the sort of hardcore blue areas, which generally are urban areas, and kind of all the other places we know about, California, New York, metro area, et cetera. But none of this could have happened with the teachers unions without the failure of the public health establishment. They enabled the teachers unions to make outlandish claims and set unreachable goals. Because tell me, Ginny, because it's possible I missed something. Do you remember Deborah Birx or Anthony Fauci forcefully coming out saying, this is ridiculous with the teachers unions driving around with fake coffins? This is not, look at Europe. They've had millions of kids in school there. Look at this study from Sweden where the schools never closed. And they found that teachers were at no greater risk than other professionals. Did I miss something? Did I miss where Anthony Fauci, came out forcefully talking about that?
No, it was just those of us in the open
Right.
schools world on Twitter saying that. And you and Tracy.
I fault the teachers unions for much in the book, and I extensively document, I think, a lot of what they did. But I'm interested in just drilling down ultimately in the book about what's underneath. And ultimately, they couldn't have gotten away with this had the public health establishment not created policies that weren't based in evidence, number one. Number two, had the public health establishment actually come out publicly and forcefully saying, we need to get the kids in school, this like only open when it's safe based on a variety of contrived benchmarks and interventions. That's nonsense. They allowed the teachers unions to then run with it. And so did the media. That by and large, the media simply, as I mentioned earlier, just kind of acted as a megaphone for the public health establishment claims, and also in many instances as a megaphone for teachers unions. And, they would interview, some kind of random teachers as, I'm terrified. Going to schools like just playing Russian roulette and these types of just hysterical, hyperbolic.
They amplified the fear.
That's right, because if it bleeds, it leads. And there's a lot of evidence that I talk about in the book where, we can see how the American media functioned quite differently from media outside the United States. And the American medical establishment oftentimes is far more aggressive than the medical establishment outside the US. I did an interview with a journalist named Ben Ryan, who's written a lot about youth gender stuff. And he was drawing a comparison between the two where it's like, America tends to be really interventionist culture. We have this sort of like, for lack of a better word right now, and like kind of a very paternalistic type of and authoritarian even interventionist culture with medicine, where we are like maximalists. Oh, you have a headache? Let's run, 5 MRIs and a CAT scan and blah, blah, blah. Sometimes that's perfectly warranted, but there is evidence that in many instances we do more than not only what's necessary, but we do more than what's beneficial, that we cause harm. It's called iatrogenesis. It's a word for harm, when the cure is actually causing harm. So to me, the teachers unions, it's important to talk about them, but this never could have happened without these other pillars of the media and the public health establishment sort of like enabling this circumstance.
Do you have any good news for us? Does this book have a happy ending?
It doesn't. But what I do hope people come away with from the book, and what it's designed to do, is to make people understand sort of the anatomy of our culture and the anatomy of decision making, and that you'll come away being able to spot some of this stuff for the next time. It doesn't have to be a pandemic. It can be some other crisis or even just the daily churn of news. When you see through these series of case studies that I have, which they essentially are case studies of the New York Times and other media outlets, the way they sort of crafted certain narratives, a case study of how public health officials were ignoring evidence and dismissing other evidence to the, that they didn't like. When you see all of this laid out in a story, in a chronology, that you kind of internalize an idea about how things work that you might and someone like you, Ginny, I'm sure you already have some of this sort of sense within you, but I hope, and you can tell me if this happened for you, if you've made it to the end, is that it's only through kind of these examples that you really can internalize it in a different way and hopefully have like a very strong sort of foundation to recognize this in the next time, so you are prepared to act, or at least even in your own mind, understand and push back against what's going on.
Well, we talk a lot about how courage is contagious. That hashtag open schools world online was really important in all of this for being like, okay, I'm not crazy for pushing back, and it's okay to speak up. And
You were
journalists like,
correct. You were
yeah,
correct, Ginny.
journalists like you played an incredibly important role to giving those of us without much of a platform or a voice an opportunity to feel seen and heard. And so that is part of the process, because I don't think just pushing back in these little online communities is sufficient when something this big takes over and is driven by those powerful voices that we've been talking about, the media, the health professionals, and the union. It's good to learn these lessons. It's also important, I think, to establish entities, organizations, community connections so that we can, I don't know, quickly rise up and make sure that
Yeah.
we're heard if something like this does
That's why it
happen.
seems so
Yeah.
important what you're doing, that, children didn't have an advocate. They were the easiest ones. There's a reason why liquor stores and casinos were open and schools were closed, because those various industries have enough advocates with influence on the politicians, but children don't. So they need organizations where like-minded, critically thinking parents who value liberties of individuals and families, that they have the ability to, as you said, rise up and be involved and advocate for the people who aren't being advocated for.
Yeah. Dave, how can people find and buy your book?
It's An Abundance of Caution, American Schools, the Virus, and a Story of Bad Decisions. It should be available everywhere. It's blown out. It's sold out of a few places, but they'll get more in stock quickly. So please, if anything that I've discussed, that Ginny and I have talked about, sounds like it's, validating to your thoughts or ringing a bell for you, or even if it's not, if it sounds new, I encourage you to please buy the book. It's big. It takes a while to get through, but I've been told it's very readable. It's engaging. I go through history. There's lots of crazy things to learn about how human beings and how medicine works and how we got to this place. You can find the book anywhere or order it, and it'll come in a few weeks if it's on back order.
Yeah, highly, highly recommend. So David Zweig, thank you for your commitment to truth and to our nation's students. And thank you for joining Freedom to Learn.
Thanks, Ginny. It was great to talk with you.
Freedom to Learn is a production of the Defense of Freedom Institute. You can learn more about DFI at dfipolicy.org. If you have feedback or suggestions for future podcasts, please reach out to us at podcast@dfipolicy.org. If you enjoyed today's episode, please subscribe and leave a rating and review wherever you listen to your favorite podcasts.